Today's webinar is titled Tribal Nursing Homes, Best Practices and Challenges, Part 2. I'd like to begin by briefly introducing our speakers, and we'll have 5 of them today. Kay Branch and Debbie Dijak will provide information on the Tribal Nursing Home Collaborative. Kay Branch works as the Elder and Rural Health Program Coordinator for the Alaska Native Tribal Health Consortium. She has over 20 years of experience working with Alaska Native elders. Debbie Dijak is the Facility Education Coordinator at the Archie Hendricks Senior Skilled Nursing Facility and Geriatric Nurse Leadership Academy Fellow. She is also Faculty and Advisory Board Member for the University of Arizona Geriatric Education Center. Wayne, Val, and Kathy are our presenters from tribal nursing homes across the country. Wayne Claus, the administrator for the Chinle Nursing Home in Arizona. He has 11 years of experience working with the nursing homes. He is currently the HUD representative for the region and tribal representative with the state of Arizona Public Schools. Val Crail is the administrator at the Manique Association's tribal nursing home facility and has held this position for the past 2 years. He has 30 years of experience as a successful long-term care administrator. He is currently licensed in Alaska and South Carolina. Val has been licensed and previously worked in Wisconsin, Georgia, North Carolina, and Pennsylvania. His work has been published in Provider Magazine. Kathy Keene is the administrator for the Morningstar Care Center and the Eastern Shoshone Executive Director of Health Programs. She is a member of the Eastern Shoshone Tribe and has 20 years experience in healthcare administration, working on the Wind River Reservation and in Wyoming. I would like to welcome all the presenters and thank you very much for presenting with us today. I will now turn it over to Kay Branch to begin.
Hi, everyone, and welcome. Let's see, I'm trying to find the... Oh, wait, maybe we were there. Yes, what I wanted to do, we know these calls usually are about home community-based services and other things, but we wanted to recognize the great work that's going on in tribal nursing homes and look for a way to share that work with each other. I know the Title VI folks, you have the monthly calls with Administration on Aging, and I know how helpful those are to you. And the tribal nursing homes don't actually have that. There are 16 tribal nursing homes in the country, and they don't have that kind of interaction that the Title VI folks have and some others. So we wanted to be able to bring them on board and hopefully develop some kind of a format where they might be able to share with each other, as well as sharing with the broader group of long-term services and supports in Indian country. Debbie Dijak contacted me in February about this idea, and we've sort of been thinking about this I've been thinking about it for quite some time with folks like Bruce Fink and Cynthia LeCount and John Johns, all in the Washington area. And I know, it was like 10 years ago. Well, I guess it was less than that, 5 years ago. We did a survey. I just did a quick survey with an intern of tribal nursing homes to see what their payment sources were, if they had any tribal monetary support, what kind of services that they provided. And so we looked at that, and then so I had all that information historically, and we knew how many tribal nursing homes there were. And so when Debbie contacted me earlier this year, we just thought, okay, let's go from that and see what we can do. So I'm going to turn this over to Debbie to talk a little bit more about some surveys we've done since then and the goals of actually creating a tribal nursing home collaborative. Debbie?
Thank you, Kay. Good morning, everyone, or good afternoon. Yes, I'm working with Kay collaboratively on this. And we're working off of what Kay has done and others have done in the past. So if you look at the slide where it says history, the survey Kay's talking about was from 2010. We did a more recent survey in May of 2015, just this year, to look at successes and challenges and educational needs in tribal nursing homes. And you can see some of the things, general categories that came out of that particular survey, mostly from the nursing home administrators. In addition, we just did another survey just within the last several weeks, and I kind of summarized it here on this slide. The tribal nursing homes are developing and implementing best practices that are culturally appropriate and enhance residents' quality of life, as well as promoting staff recruitment and retention. Those are some of the themes that came out of that second survey. I'd also like to share with you who is currently working on this collaborative for tribal nursing homes. And again, myself and Kay Branch, Kaufman and Associates, some of the people that Kay just mentioned, Banner Health up in Phoenix, Jan Doherty, Jane Moeller, at the University of Arizona, the recently funded Geriatric Workplace Enhancement Program. Francis Stout, one of our board members here on the Tohono O'odham Nation, and Leo Litsky, our administrator here at Archie Hendricks. Some of our goals and objectives is to establish best practices among tribal nursing homes and stakeholders nationwide, and utilizing evidence-based education training and quality assurance interventions and linkages. Some of the short-term objectives, which we are starting to look at, is assessing the learning needs and challenges of tribal long-term care facilities. We're getting some survey and direct feedback from our care partners, bringing interested stakeholders together to discuss best practices. We want to pilot some of these practices using CWAPI principles, supporting other facilities throughout this change process, and identifying and developing educational resources that will assist in the process. And to that end, we're looking at the WEPs that were recently funded across the country. Sustainability is just, create and sustain a body of best practices among tribal nursing homes, and a body of supportive interdisciplinary healthcare professionals that are committed to the same. And so that's our goal. And so a call to change and a call to act. This is our second webinar about this collaborative. We will be hosting a telephone conference in August 19th. There is going to be an inaugural meeting for this collaborative on Wednesday night, October 14th, and that's the night before Banner Alzheimer's Institute in Phoenix will be having their inaugural conference on dementia and Native American impact issues and next steps. So I know already we've had 4 or 5 administrators saying they will be attending, which is absolutely phenomenal and wonderful. So we're very excited about that inaugural conference. Thank you.
Thank you, Kay and Debbie. Do we have any questions from the audience? If you have any questions, you can type your question in the Q&A box or press *6 to unmute your phone line. And it looks like we do have a question. Kay and Debbie, have you ever surveyed residents, and what were the findings?
No, we sure haven't, but that's a great idea, and maybe that could be something that comes out of the collaborative is to, kind of create a tribal nursing home resident survey.
Yeah, I think that's a really excellent question, and it is something that this collaborative, when we meet in October and kind of put together, our kind of mission and what's happening, that we need to look at. Thank you.
I think that's a really excellent question. Something that collaborative October and together.
Okay, if there are no other questions at this time, we'll move on to Carol to present. And remember, you can always type in your question at the Q&A box.
Hi, and I want to thank Debbie and Kay for this opportunity for us to present about our efforts here at Utupana'ina on improving the quality of life. And our focus has been working on traditional foods in nursing homes. This is a little bit about the area that we are in. We're in Kotzebue, Alaska, which has about 3,300 people. And it's the largest city in the Northwest Arctic Borough. In the lower 48, we would call those counties. And this is an area that in the borough, people have lived here over the past 10 to 15,000 years. It's a small community. And in 2011, the Manilik Association opened up an 18-bed long-term care nursing home. And this was a long-time goal of the board here to keep the elders close at home. Before that, they would have to go to a nursing home, would have to go to Anchorage or to Nome or to Bethel. And our mission statement is working together to make our elders' lives better. At our facility, we do have a deep respect for the elders' culture, their beliefs, and their way of life. And so we try to continue those by having them go ice fishing, by, as you see, cutting up salmon and going out. We recognize every elder is a full human being with different needs that must be met through their lifestyle, empathy, and interaction. The elders in our area grew up eating food off the land, and it's actually been only within the last 30 to 40 years that you can go to the store and buy fresh foods. Even now, over half the food in the community comes from the land. And just to show a little difference in the values here, this is a poster from the 4th of July where mixed in with nachos and hot dogs we're serving caribou soup and Eskimo salad. It's a different environment. And again, these are some of the practices here just in the community. The resident elders here currently, they enjoy what they call a monthly nickapack, or as we would know them as a potluck. They would like it if we could serve native foods out of our kitchen so that they could get it on a more regular basis. The challenge that we've worked with is that the federal government would also like to do more person-centered activities and promoting choice. But with regards to food, you've got an issue of following the federal regulations. In terms of nursing homes, F371 of the federal regulations reads facility obtains food, stores and consumption from sources approved or considered satisfactory by federal, state, or local authorities. It doesn't specify where the final oversight comes from, be it USDA or in Alaska's case, Department of Environmental Conservation. And recently in 2014, the Farm Bill was passed by Congress through Senator Begich-sponsored legislation, allowing native foods to be served in nursing homes, but yet no facility in the state was serving traditional foods out of the kitchen. The legislation, however, did pave the way for discussions with the USDA and CMS. So the question comes down to who has jurisdiction over food served in nursing homes. There's two answers. One is has jurisdiction over food being processed, and one inspects the nursing homes. In our conversations with the USDA said that they had no criteria for inspecting moose or caribou, despite being members of the deer family. The hurdles, if we had to clear, if they had been, was that we would have to kill only the animals in the head, and the animals would have to be checked by the USDA inspector prior to killing the animal, and then also after, any mortem and post-mortem. Currently, there's nowhere in the U.S. where those meats are available for sale to the public. When we talked to the state surveyors here, Alaska Department of Health and Social Services, they said if the processing plant, something like that would have a stamp of approval from the Alaska DEC, that would satisfy the nursing home requirements, F371. And the regional office, our conversation with them actually agreed. And the surveyors also mentioned that, CMS mentioned that if there's any questions, concerns regarding origination or processing of the animal, the surveyor should produce documents which indicate where the meat in the processing center were compliant. That's 371. And those are some of the things that they had looked at. With regard to Alaska, in Alaska, they do have a provision for serving traditional wild game, seafood, plants, and other foods donated to an institution or a nonprofit program. And these are the regulations here in the Alaska codes. Talks about if we do receive food, let's say fish, let's see the food received whole, fish are gutted or gilled. If it's meat, as quarters or roast without further processing. The facility can receive a donation from the hunter. If it's a hunter donating the meat, because they're not considered as a meat processor, they can only donate it to a certain size. They sign up for the healthcare facility or institution to process it further. And then, obviously, as you see, there are some requirements. Animals have disease, food is butchered, grass transported, stored to prevent any further issues or undesirable growth. And because they're there. Now, there are some foods that are not allowed to be donated here. One of them, for example, polar bear meat, walrus meat, eel oil, whale oil, and any fermented food. For the Alaska public, one of the challenges is that here in this community, they grew up on seal oil. But because of the issues there, especially how do you get that food? And currently there are several, actually 100 groups working together on this issue. There is actual seal oil commission. Let's see what they can do to help out here in Central Alaska. Now, our community, the Neelix Association, has a hunter support program that provides elders with native foods. The Neelix has been working on building a meat processing plant, and this is actually finished. We just did our grand opening in the beginning of July. We do have a permit for the facility, and from the state's point of view, now that we have the source, the food that we receive from that facility is good to go. Again, with the issues of nursing homes, you have to have food coming from a source that is deemed satisfactory. We actually had the state and the nursing home inspectors meet together, and it was accepted. And there's little risk or no risk of foodborne if the foods are prepared and inspected by knowledgeable hunter-gatherers. And this effort is actually bringing us closer to meet the mission of our facility, Tukana Ina, which is focusing on providing them food from their life and being able to let them choose the food that they need. Food from their life and being able to let them choose the food that they have used. Any questions we can answer? Any questions we can answer? Well, thank you very much. Dedication. Thank you very much.
Hi, now it looks like we do have a question.
Yes.
Has there been any instances of contamination? If so, how was it, or is there a future plan to address it?
We have not had any issues here. I think when you get into things such as fermented foods, and we have an elder actually who is farther from the northwest of here. Those are things that they would look at. I know the state of Alaska here is concerned about things such as seal oil, because there is no processing center commercial, if you will, in the state, and they did have an issue of botulism earlier, and the state's rightfully concerned on that. I think one of the things here we'll give credit to the state of Alaska. They are willing to work with facilities. What they're looking for, though, is how do we make this work? So a lot of credit to the state of Alaska. And it's not just this facility, but a lot of facilities and people such as Cave Ranch, and I'll put a shout out there. You have Dr. Ferguson, who does the Store Outside Your Door series. You have a huge effort throughout the state to how do we make this work for the elders and for the people of Alaska.
Great. There's another question. Are there any long-term care facilities in the South region of Alaska? If not, do you foresee future possibilities?
There are facilities here in the South region. Alaska is a huge state. I think there are 17 some nursing facilities throughout the state. There are, I think, about 4 in the southeast area, 3 to 4 in that area. But Alaska, when you look at it, is just, I guess you could almost put Texas and California in there. So we are the only facility here in the Northwest Arctic Borough, which is an area the size of Indiana.
Yeah. If I could help with that, this is Kay Branch. There are 3 tribal nursing homes in Alaska, one in Kotzebue, which is in the northwest, one in Bethel, which is in the southwest, and one in Nome, which is a little bit in between, a little bit south of Kotzebue. The other nursing homes that are here in the state are all non-tribal, and yes, there are 16 or 17 nursing homes in the state. I wondered if that question was from the southeast of the United States, and so I will answer that. There is one, the Choctaw Residential Center in Philadelphia, Mississippi, and the Saudi Care Center in Cherokee, North Carolina, and those are the only ones in the eastern region of the U.S.
There is one other question. How difficult is it to get medication where Val is located?
That is a challenge. It's like anything else that you ship here. The largest city in Alaska is Anchorage, which is 540 miles away, air miles. So it's a distance. There is no backup, let's say a CVS or a Walgreens here, if you will. So things do have to get shipped up, and like not only with medication, supplies, there are delays, and you also run into that with the weather. We don't have the friendliest weather, if you will. You have the winter at times can reach 30 below. So trying to get things here and consistently, sometimes you do have challenges. If the weather is bad enough that your plane may not come for a couple of days.
Another question came in, Val, and the question is, how much would it cost to implement this program fully?
Currently, the program is being funded through the Manilic Association. One of the things that's a little different about this is that they also not only focus on the long-term care facility, but they also focus on providing subsistence food, if you will, to the elders in the community. It's not just focused on the nursing home, but also elders here who need it. And so that's the other initiative of the program. It's actually an outgrowth of a Title VI program back in the 90s. And so then the food is donated to the people in need in the community, and the other piece of it is also then food's donated to the long-term care facility. There used to be a senior center here where they did actually eat traditional foods such as moose and caribou, salmon, sheepfish. But with a nursing home, obviously the regulations are a little different, and it's a little, you have to watch for certain things. In terms of cost, let me go back and try to answer the question a little better. Currently, a facility, if they have their kitchen has a permit, they can actually receive donated meat, donated game. And then the question then becomes, can you process it further? If you get, let's say, a roast of an animal, you cut it down into manageable portions. You also have to look at nutritional values. If you receive fish, you have to be able to break it down further to fillet it, and then obviously you would hope that your kitchen staff has the training or knowledge to recognize if the food is good or bad. So the state of Alaska changed a little bit in the sense that they have accepted, the nursing home inspectors have accepted, if you have a permit in the kitchen, as being the approving authority. So that was actually pretty huge. The other thing they accepted was that we here have a lot of berries, such as blueberries, such as lingonberries, salmonberries. And they accepted our argument that the tundra is our garden. In the lower 48, we have its traditional gardens, where the residents grow their tomatoes and plants. Here, they allow us to expand it so that 200 yards away, if you go out in the fields, that we can harvest those berries and still call that our garden. So a lot of flexibility here.
Okay. Thank you, Val. We do have one more question, and then we will move on to Kathy. The question is, how do you look at the food-drug interaction?
We haven't really looked at. We're currently looking at the basic things to serve, such as your moose, your caribou, your salmon, your sheefish, ptarmigan, which is a bird, duck, etc. We're not really stepping out yet into other things in that area. And there are many places where you can actually get your nutritional breakdown of the meat you're serving. Caribou and moose. Caribou, for example, is a very lean meat. There's a lot of websites such as Skip the Pie, and there's books out there that talk about nutritional analysis. I think the biggest thing for the elders here is the food's healthier. There's less additives, less preservatives in the meat. It's like right off, literally here. I mean, just north of Kotzebue is the largest herd of caribou in the state of Alaska, about 230,000. So for them, it makes sense to go out and harvest that instead of having, say, ground beef or chicken shipped from 2,000 miles away. And that's part of it, because the food is important to them that way. It's right here in the city, which is how they've grown up for generations.
Okay, great. Thank you, Val. At this point, we will go ahead and move on with our presentations and turn the time over to Kathy.
Hi, I'm Kathy Keene, and I'm the administrator here for the Eastern Shoshone Tribe. And just to share a little bit with you about Morningstar Care Center, our mission is to provide compassionate care in a comfortable, safe, home-like environment. And as I share with you some of the things that we've gone through, I just wanted to share a little bit about Morningstar Care Center. We were established in 1985 by the Eastern Shoshone Tribe, and we were created to basically serve Fremont County. So with that, we are a 45-bed skilled nursing home facility. We provide services to both our Native population as well as our non-Indian population. And so basically we're licensed for both Medicare and Medicaid, and we serve, in our population that we have the Eastern Shoshone Tribe here, the Northern Arapaho Tribe here. We have many other tribal people that live on our reservation. But with the non-Indian population, we are basically considered one of, at least from the non-Indian view, considered a very caring facility. So part of our facility, we probably have about 50% of our population are non-Indians. And so we have been in that function for the last 30 years, and we continue to strive. So on this piece, these are some of the services that we offer. We have skilled nursing care, rehab, physical therapy, all of those therapies. Some of those we contract out. We do have a physical therapy assistant on staff who does some therapy in-house. One of the things I wanted to highlight was we started providing services around respite and hospice services as ways to fill our beds. The other piece just to kind of comment on is just the activities. I know we try to provide culturally appropriate for the community. If you look at Wyoming, we're very kind of Western themed, so we do lots of things in the community when it comes to, taking our residents out fishing. And some of the individuals, because of Wyoming, they like to go. We even take some of them to some of our local bars, and they play pool, they have non-alcoholic beverages, those types of things. We're also in a very, what you call frontier state, like similar to Alaska, a lot of ways from a lot of places. So we try to do what we can, to kind of accommodate our residents around activities. Because of our locations as well, we don't have also the availability for some of our providers to actually come visit our providers in the facility, so we end up taking our residents to them, especially at the IHS clinics or some of the local providers where their main provider is at. One of the things around personal care is we reopened our beauty shop. We started with the beauty shop many, many years ago. We closed it, and it's one of those things that we've now reopened within the last 6 months. So that's been something that's been an added piece to our services. I wanted to share with you many of the challenges. Like I said, we started in 1985, and in the last 30 years, I would say we've been tribally operated. We've been operated by management companies. We've been, and this has probably gone back and forth over the last 30 years. And I would say about 5 years ago, the tribes decided to take it over again and start operating on their own. However, we've always had these challenges in regards to being able to keep our doors open. So I'm sharing with you some of the things that were prior to 2013 when I actually stepped in to kind of assist the tribe and to kind of give you a little background. Being a tribal member here, I've been involved probably with the nursing home from an outsider for quite some time, running the Indian Health Service here as well for quite some time. We were never really involved with the nursing home process, and so that's one of the things that I've tried to do since I've been here. But going back to our challenges, the tribe was always contributing in excess of $500,000 a year to the operations of the facility. And when they asked me to step in, they were at a point of deciding whether we continue to close our doors, again, offer out to see if we wanted a management company to run, or see if we could find a way for the tribe to sustain operating the facility. We had, when I stepped in again, our indebtedness to vendors and other places were in excess of over $800,000 a year, even though the tribe was still supporting us. When I stepped in as well, we found that the facility was overstaffed. We've always had high administrative turnover. I know it's always been an administrator. I think that maybe many nursing homes see is the high turnover amongst administrative staff as well as other staff. The other thing that we saw here too was our compensation was very non-competitive for the market. So us being down the block from the Indian Health Service, they were always, because the federal system could always pay more than the tribes could, we were losing our staff to the Indian Health Service or other places. And a lot of the things that we saw here too was the facility was contracting traveling RNs. So we had RNs coming in from Nebraska and other states to come in, and so those were high costs as well. And we always, I think some of us see there's always a lack of those support staff like CNAs and those types of things. So there were several challenges that we've had to overcome. I think in even being in business for over 30 years, it's a constant change for nursing home processes. because of all the regulations that are that we have to meet as well. I wanted to share with you some of the progress that we have made. I know when I stepped in, we basically had to decide, and I think my recommendation to the tribal council at that point was, because we're such a needed service in this community and wanting to keep our residents at home, we decided at that point to try to see what we could do to save the facility and remain as a tribally operated facility. So we took a point of trying to restructure the organization and staffing. Many of us wear many hats, and so we had to cut down on some of the staff that was here. We also, because of the staffing needs, had to cut down on the number of beds that we could fill just to meet the needs. We lacked CNAs to kind of meet the support needs that we needed in taking care of our residents in great care. Also looking at what we've had to do, a lot of our vendors, the contracts were substantially higher than what should have been. And so we took a point of trying to review all those contracts. We got away from contracting RNs and offered them permanent jobs with us. So that was in order to cut some costs. We looked at different things we've had to do and trying to consolidate. One of the biggest things that we did because of the Affordable Care Act and the reauthorization of the Indian Health Care Improvement Act, it did recognize the tribes as nursing homes, even though IHS will not fund nursing homes. So we were able to include our nursing home under our Tribe 638 annual funding agreement. And through that process, we were able to negotiate with the state of Wyoming because the state of Wyoming recognizes 638 facilities in the all-encounter rate or an encounter rate. We were able to negotiate with the state of Wyoming an encounter rate that was substantially higher than what they were paying the rest of the nursing homes in the state of Wyoming. And so from that standpoint, that has probably led to us being more successful in getting out of debt and being sustainable, to where the last 2 years the tribe has not had to contribute any dollars towards the operation of our facilities. We're fully self-sustaining at this point. One of the things, and when I talk about an appointed liaison, that was basically me. I am the health director for the Shoshone tribe, and I oversee all of our facilities, including our dialysis center and our tribal health programs as well. And so having somebody that was that could take things to the leadership when there was issues that came around were probably one of the biggest things that needed to happen. Instead of having to deal with reaction things, we were actually looking at things a little more proactive and things that I could assist the nursing home administrators with at that point to kind of look at what we could do to sustain the business. Some of the things that we're also looking at, we have signed up with the QIO in Wyoming, which is the Quality Improvement Organization for Wyoming, so that we can start getting involved with more of some of the things that people are looking at around quality assurance, performance improvement standards. We've gotten some of those projects. We're actually starting to look at things that we can put into place at the facility to improve, and we actually are looking at trying to improve our nursing care services to our residents and trying to figure out how we can change some of that environment. Our progress as well, too, is we're stabilizing turnover. And like I stated before, we actually have offered, even though they are contract RNs and CNAs, that they're actually employees that are locally. So we've been able to save some dollars by not making them employees, but making a contract with them, and they become a contract employee. And those have helped to stabilize turnover. It actually helped us to recruit more individuals, that we have more staff available to take care of our residents, that we're not having to depend upon an actual employee that is out for sick leave or vacation leave or something. The RNs are actually paid for actual time worked, and the CNAs as well, and that's working very well for us. We've gotten our accounts payable to within 30 and 60 days, and And actually, for the first time, we've actually been able to put money back into the facility. Our facility is very old as well. So I think in some of those things, just sharing the things that we've done over the last, 30 years and where we've come in the last couple of years has been very helpful. One of the things that we've been able to do, too, is the nursing home has always been its own standalone facility. So they never really collaborated with the IHS. They never collaborated with our dialysis center or our tribal health programs. And so that's been one of my goals, is how do we all work together? And a lot of it is educating the Indian Health Service about nursing home care and the rules that apply, and why a resident needs to see their primary care provider within a certain time limit, because that affects your payment structure, et cetera. So it's been one of the things, I think, in understanding nursing home care in Indian communities has been something new, I think, to a lot of people, and how we can all work together to better serve our residents. And that's one of the goals, I think, our tribe itself. I mean, we have a lot of residents that would prefer to stay at home, so there's always lots of things that we're looking at of how can we provide more services for individuals in their homes without having to come to the nursing home. Some of the things that I've seen since I've been here is our own tribal members really didn't utilize the facility as often as you would think they would, because there was always, I think there's been just so many issues that have come around operating the nursing home that they didn't really trust that. And now, over the last probably 6 months, I have seen more of our own tribal members actually wanting to come and request nursing home services and seeing what we can do. So I think it's been a whole education process, I think, for all of us at a community level to understand really how nursing homes fit into our community. And really that's kind of what I wanted to share with you, was just some of the challenges and the progresses of a nursing home that's been in business for over 30 years. And if there's any questions, I'd be happy to help.
Remember, there are two ways to ask a question. You can either press *6 on your phone to unmute your line, or you can enter a question in the Q&A box.
Kathy, this is Kay Branch. I really thank you for your presentation. It's been very enlightening to me, and just with the fact now that nursing homes, with the passage of the Indian, the reauthorization of the Indian Healthcare Improvement Act, that now allows nursing homes to be sort of part of that IHS structure, and then thus allowed you to actually negotiate a special encounter rate with the state. I think that's really huge, and I think something that other folks could learn from. Was the encounter rate set by the federal government or by the state of Wyoming?
The encounter rate was set by the state of Wyoming, and it was one of those things that we had to go back, because some of it's still tied to your cost report, and so lots of things that we had to fix was kind of show some things. And my prior negotiations with the state through Indian Health Services, we kind of looked at an encounter rate from when a provider would say, because our services here at Wind River were clinics, and so we do have providers that have privileges in the hospital. And so there was a reduced encounter rate when our provider actually saw our patients in the hospital. And so the state ended up agreeing to that rate, just simply because we do serve non-Indians, and because of that encounter rate applies to everyone, Indians and non-Indians alone. So the state had to look at the increase in their costs for taking care of the non-Indian population, and we had to come to a kind of a middle ground for that. And so we agreed upon, that reduced rate that they were already giving the IHS facilities when their doctors see a patient in the home. And this is something, too, that I think has been helpful. I know I've been working and assisting the Crow tribe with what they're doing in Montana, and I think they're to a point right now where Montana might be looking at what they call a SPA, which is a thing you have to do to allow CMS to look at a rate for a nursing home. But it is something that I've had conversations with Region 8 of CMS to kind of look at how something could be done from the federal level, which would make it easier for all tribes that have nursing homes if they wanted to look at an encounter rate from that standpoint.
Yeah, that's great. Thank you so much.
Well,
we do have time for one more question, Kathy, and then we will move along to Wayne Claus. The question is, have you thought about or tried to use telemedicine with your residents?
We have, however, the infrastructure in our reservation, we still have a lot of copper lines and no access to T1 lines. However, we've been working with one of our local telephone companies to bring in fiber optics, so we're hoping that that's going to be an option for us. It's an infrastructure on reservations, I think, is what we lack.
Great. Thank you, Kathy. And remember, if we do not get to your question today, we will have our presenters follow up with you. Wayne Claw, are you on the line?
yes, ma'am.
Okay, great. All right, if you want to, you can go ahead and get started.
Oh, you want me to go ahead and start? Okay. Thank you. My name is Wayne Claw. I'm a tribal member of the Navajo Nation here in Chinle, Arizona. We're right in the middle of actually, we're located in northeast side state of Arizona. I work here as a CEO for a nursing home. I've been here 11 years. I spent numerous years in Washington, D.C., working for FEMA and Corporation of National Services on a lot of disaster areas. Spent a lot of time there. You know, I came back in 2007, and I actually was getting ready to retire at the time when the board asked me if I can come to work for them just for at least 5 years. At the time, this nursing home started back in 1967, and I actually used to be under the Division of Finance of the Navajo Nation, and they ran out of money, so they decided to incorporate it under the Navajo Nation and the state of Arizona and try to get Medicaid money. So that's what they did in 2000. I think it's 2019. I'm getting my years here mixed up. Anyway, they started it back 11 years ago. No, not 11 years ago. In 1970s, when they made that attempt to incorporate it and get a business at least under the Navajo Nation, which they did. And when they did that, they directly made a contract with CMS and with the excess office out of the state of Arizona, because due to the tribe not having that money to run the nursing home. The biggest problem I think we have here, we have a 79-bed facility. We're completely full. And right now we're just a level 1 skilled facility. We're not level 2 and 3. Basically, the reason why we're not level 2 and 3 is basically because this building we're situated and has a lot of, there's a lot of asbestos still in the building, lead paint. And we just don't meet the requirement with CMS to go to those 2 levels. And I've been trying to get that, but actually out here, this building belongs to the Navajo Nation. And we've been trying to get the nation to change the building, do some improvements on it. But we haven't been able to do that until lately. We finally got some good answers that we might be getting $30 million for a new facility. Half of the money will be coming from the HASA through the Navajo Housing Authority, $15 million and $15 million from the Navajo Nation. So it looks like we're going to we have a meeting with them on August 5th. So I understand that's when the president called me from the Navajo Nation, telling me that that's when they're going to finally make the decision to give us the money to increase and have a new facility for 120 beds. At that time, after we do that, get a new building, CMS will be allowing us to go ahead and go to level 2 and 3. One of the biggest problems we have a 638 contract with the Navajo Nation Social Services. majority, about 20% of our client comes through the Navajo Nation social service. They have their own regulations. They have their own policy on how they submit the elders from the Navajo Nation. And we also have the Navajo Nation Title IX, they call it, which has to do with elders, how the elders would be taken care of, the cares. And the law conflicts a lot with the CMS regulation. What I mean by that is that the Navajo Nation, under the Navajo Nation law, the Title IX, also social services policy is that we admit to everybody. It don't matter what condition you're in. So when we do that, and we're on level 1 here, CMS fines us for those things. Fines us if we have a gentleman or a grandma that's maybe in their facility that's at level 2 and 3. We do have an account already set up with access that we can do that, but it's not allowed through CMS. So we have a big problem with that. We've been having problems with this since I've been here. So it conflicts a lot, and I have a lot of problem with that. And one of the things that when I came in was the CNS would not allow us to serve traditional and cultural food. And I 11 years I've been making an attempt trying to make those changes, and finally it did happen here about 2.5 weeks ago. And I don't know if you guys got copies of those. And I've been fighting with them on those issues. I'm still fighting today with them on changing a lot of the regulations that would apply to tribes. Because as I know, I had grandparents and my mother and father, they passed away at home. That we I think as tribes we know how to take care of our own. And that's one of the things I've been stressing to CMS all this time and fighting with them on this. I've been able to get legislation through the state of Arizona this past Saturday with the help of Congress Lady Ann Kirkpatrick, who sits on the Health and Human Services Congress. So I've been able to do that. I have a lot of support from the senators of the state of Arizona to really try to continue that, to try to make those changes. I've sent letters out to many, many newspapers, even LA Times, New York, Washington Post, and I had a lot of response when they did a lot of interview with me the last 2 weeks. With a message out there trying to make those changes where EMS is appreciating a lot of things that doesn't work for the tribe. So, anyway, I guess I've been raising hell for a while here with these people anyway. But we do need the tribe does not provide us any money other than the 638 contract we have with them for 25 of our patients here, our elders here. Other than that, we get all the money from the long-term care. The last 3 years I've been working on, since we're short of money and the tribe wasn't providing any money, I've made many attempts to try to allocate, find more money. One of them was the allotment taxes through the state of Arizona, which the state says, well, the tribes here, 11 tribes in Arizona, does not pay any allotment tax, which is not true because we have a lot of Native Americans that live in cities, Flagstaff, different places where they bought land, and they do pay allotment taxes. So we were able to prove that to them a year and a half ago through the state legislation, and finally they're giving the nursing homes like us $400,000 a year, which is helping us out a lot. We have on our business lease, we have some old buildings which we renovate, and we're able to rent them out to the colleges, Navajo Tribal Technical University, to be able to try to provide nursing classes for nurses, because we're really very short of nurses in our area. We're located, the closest big town we have is 110 miles from Chinle, and most of the other towns are more than that, 120, 130 miles. So anyway, we're able to rent the buildings to them, and we get additional $170,000 for that. And the one good thing about it, too, is they're providing nurse classes now where we can get some CNAs in our facility. We work very close with Indian Health Services here in Chinle, another one Fort Defiance, another one Crown Point, which is 2.5 hours away. We've been able to use a lot of their nurses, RNs, and other licensed nurses to use them here in exchange. So they travel here Right now we have a project that's going on for $3.2 million for new apartments here for our nurses. And that money was coming from the HOZ. I've been able to get that 2.5 years ago also. Then we also have another 10 that'll be renovating here, which is we finally it was given to us by the housing authority as ownership. So we'll be putting $1.8 million to that. The construction probably start until the award slips for the contractor about probably in the next couple of months. So we have that going. So I've been running around trying to get money for this. But I think a lot of things like I mentioned that challenging is that we have an old building. We have asbestos in the building, other things, and we have Office of Environmental Health, which is operated under the tribe here, that tells us not to touch the building or the ceilings where the asbestos is. But and in return, EMS is, well, you got to install certain things like security cameras and things, and it conflicts a lot. The biggest challenge I think we have is the conflicting regulation between the tribe and CMS. So those things need to be changed where we have that good government-to-government relationship. So that's some of the things that we have problems with. But again, we've been improving a lot more. When I came in, the place was about to be shut down by IRS because it happened that, I guess it happens most of the tribes too, that people are sticking their money in their pocket, and it creates problems. So IRS was about to shut them down, basically because they weren't paying employee taxes. When I came in, they were about to shut down. We did an abatement with IRS. We're able to prove to them we can change the books around 3 years, and they forgive us on that. $319,000. So we're able to correct that, and there's numerous things we've improved since then in a lot of areas. So hopefully in a couple of weeks I'll give you a good report, because on August 5th is when we're meeting with the president, and they do have money, and I've given them many proposals to get a new building, and I right now, as of this morning, it sounds really good. That's positive. They're going to give us new money for 120 beds. At that time, we're going to be changing. Once we get going, once we open the place, we'll be able to go serve people here level 2 and 3. We have 87 just from the state of Arizona. We're located in 4 states. I'm sure you guys understand that. I know we're in Utah, Colorado, New Mexico, and Arizona. Our reservation lies in those areas. And just in the state of Arizona, we have 87 grandmas and grandpas that are off the reservation, off reservation facilities. In Utah, they have 36. New Mexico, they have 67. In the state of Colorado, they have, I think it was 23. So that's how the numbers of elders we have off the reservation that we need to bring back. And we sure like to bring them all back so we can serve them ourselves. So that's some of the things that I just want to generally give you a report on. And again, there's one attempt I'm making now is that CMS has a tag, they call it the Tribal Advisory Group. Most of IHS serves few representatives serving on there, and there's really no representatives from nursing home tribes. And I'm trying to get the president. We have a new president here just in the last 2 months, new president, vice president. So I'm trying to get them to get me on that tag team so we have some representation. And presently we don't. And of course, IHS don't know a lot about nursing homes. And our tribe do not know a lot about nursing homes, so we've been educating them a lot on that. The Net College, as I mentioned earlier, the Navajo Technical College exists here in Chinle now. We rent a building to them. And they started classes 2 months ago with nursing programs with them now. So hopefully that we'll be able to fulfill a lot of those spaces that we have in nursing. We have a staff of 67. And I have 19 on contract. Those are PTs and OTs. They help us out here. We have an MOA with the Indian Health Services, which is only 100 yards from us. We have an airport that's only half a mile from us also, to provide services in case of emergencies. So we're a little bit better off than before, but our goal is to get better and better. And really, I think the care, we're hoping hoping that we can get the state to do courtesy surveys for us, because right now Laguna has done that in New Mexico, and I think the state understands us more about the tribes than being as sending people out here. I have no idea what we do out here. So that's some of the things I'm working on again now to change a lot of those things, legislation to the state, and also working with Congress Lady and Kirkpatrick. So that's some information I wanted to provide with you. And a while ago I was listening to the lady from Wyoming. You know, it seems to have some of the same challenges she has also. So thank you. And if you have any questions or anything, you can I have an email, winclaw@yahoo.com. You guys are welcome to contact me anytime. As I mentioned, I send letters out to all the newspapers in the United States, most of the major papers, and I'm sure you'll be reading about us, some of the challenges too, and also some of the problems we had here with CMS and trying to pull a license, basically because we're old buildings.
Great. Thank you, Wayne. We have reached the top of the hour for this LTSS webinar. If you have questions in the future, you can email ltssinfo@kauffmaninc.com. That's KAUFFMANINE.com. You can also view past LTS webinars at the LTSS Technical Assistance Center on the cms.gov website. In closing, I would like to remind everyone that today's webinar was recorded and that the audio and PowerPoint will be made available online in the near future. Thank you again for joining today's CMS LTSS webinar, and thank you to all of our presenters. This concludes today's session.
Okay, thank you.